I'm Jennifer Kawwass. I'm the medical director at the Emory Reproductive Center, and I'm also an assistant professor within the Division of Reproductive Endocrinology at Emory School of Medicine.
I'm Heather Hipp. I'm a member of the Emory Reproductive Care Team and an assistant professor in the Emory School of Medicine. So from your perspective, what are some of the largest challenges that we face as physicians taking care of women with infertility?
Great question, Heather. I think one of the biggest challenges facing women is society's perspective of infertility. It's often not necessarily viewed as a disease, and it can be embarrassing or difficult for a woman to come to a physician to talk about infertility. Another piece of the puzzle is education about the fact that it's not just a woman that can contribute to infertility, but it's actually the couple as a whole.
I think it's really important. That's one of the things I learned from you from watching you in clinic, is talking about how normal it is to patients, because people feel so isolated and alone when they come in, and saying how common it is that infertility affects 1 in 10 couples who are trying to conceive.
So how do you think that the Emory Reproductive Center is helping to improve the patient experience with infertility?
Well, I think one of the really neat things that we've been able to do is improve access in the Atlanta area and in the greater Southeast. A lot of times fertility care is concentrated among women who might have the financial resources to pay for care, and fertility really cuts across great swaths of socioeconomic issues. What exciting things do you foresee in the future for our field?
I think there's a lot to look forward to in the field of fertility. It's sometimes easy to forget that it's only been 37 years since the first IVF baby was born in the United States, and how far we've come just in the last 37 years. I'm hopeful that our treatment will continue to improve, and that the pregnancy rates will continue to improve. I also think that we're making progress with regards to insurance coverage of infertility to help in broadening access to fertility services. There are already several states in the United States that have mandated coverage.
I think one of the really neat things is that we've been able to offer a lot more fertility preservation than we could even 5 or 10 years ago. And so we've been able to really broaden our outreach to a lot of young women who have a new diagnosis of cancer, who might be receiving chemotherapy or radiation, and allowing them to undergo oocyte cryopreservation prior to embarking on their cancer treatment.
What do you think is particularly special about the Emory Reproductive Center?
One of the reasons why I stayed at Emory was because it was at an academic institution, and I wanted the ability to have residents and fellows around, and I think that it really helps patient care as well, because they know that we are using really medically evidence-based treatment to take care of them.
I agree completely. I consider myself lucky to work at the Emory Reproductive Center. I think we're able to get to know each of our patients very well, and to bond with them, and then to also tailor their treatment plan as a team in a way that is specific to them and will optimize their individual success.